"Doc, I don't know what's going on down there." That's what John, a 63-year-old retired electrician, said to me last week as he sat on the edge of the exam table, looking uncomfortable. He leaned in, lowered his voice, and added, "My penis feels dry, a little itchy, and honestly, I've lost some sensation. Is this just aging?" I asked him a few more questions. How was he cleaning? What kind of soap was he using? How often did he wash? Turns out, John was scrubbing his genitals every morning with antibacterial body wash, then applying talcum powder to stay fresh. And he had no idea he was damaging one of the most sensitive parts of his body every single day. John isn't alone. In fact, many men over 60 are unknowingly sabotaging their own manhood through daily habits that feel clean or healthy, but are actually the opposite. They're using the wrong soaps, wearing the wrong underwear, ignoring warning signs, or depending too much on pills without understanding the real issue. So today I'm going to walk you through 5 of the most common penis care mistakes I see in men over 60, and what to do instead. These are small changes, but they can make a big difference in comfort, sensitivity, performance, and long-term health. No pills, no gimmicks, just simple, urologist-approved wisdom that most men were never taught. And who am I? I'm a board-certified urologist with over 30 years of experience helping men protect their most important asset. So if you're a man over 60, or loved one, this video might just save you years of silent suffering. Please leave your questions below, and like or share this video if you find it truly helpful. Let's start with the most common mistake I see almost every day. What is it? Let's find out. Washing too much or with the wrong products. Let's start with the most common mistake I see in men over 60. They're overwashing their penis, or using the wrong kind of soap. It sounds harmless, even hygienic. But this one habit alone can lead to dryness, itching, burning, redness, and long-term sensitivity loss. Let me explain. The skin on the penis, especially the head, is extremely thin and delicate. It has a natural moisture barrier and healthy bacteria that protect it. When you scrub too hard or use harsh soaps, you strip away this natural defense. Many men like John think they're doing a good job staying clean. But what they're really doing is inflaming the skin, irritating nerve endings, and disrupting the pH balance of the genital area. And after 60, your skin is already thinner and slower to heal. Now you might be wondering, what's the right way to wash then? Here's what I tell my patients. 1. Ditch the antibacterial soap. These are meant for hands, not genitals. They're too strong and can cause micro tears in sensitive skin. 2. Use warm water and a mild, unscented cleanser, preferably one labeled pH balanced or designed for intimate areas. 3. If you haven't been circumcised, gently retract the foreskin and rinse with water only. No scrubbing. No soap inside. For pat dry. Don't rub. And never use powder, cologne, or body spray down there. One of my patients once said, "I thought smelling good meant being clean. But that cologne he used on his inner thighs? It gave him a chemical burn that took weeks to heal." Here's the bottom line. Your penis is not a dirty car. You don't need to scrub it to keep it healthy. That's a hard truth for many men to hear, especially if they were raised with the idea that cleanliness means forceful scrubbing. But when it comes to your genitals, less is more. If you've already been overwashing for years, don't panic. Most irritation and sensitivity loss can be reversed if you start treating the area gently. Give your skin 1 to 2 weeks to heal. Switch to warm water only for a few days, then reintroduce a gentle cleanser every other day. Avoid tight underwear during this time to minimize friction. You'd be surprised how many men report increased sensitivity, comfort, and even stronger erections, just from treating their penis more kindly. Now you might be thinking, okay, I've got the washing part down. But what if the skin still looks strange, flaky, or discolored? That's a question I hear all the time, and it leads us to the second mistake I see far too often. Let's talk about it. Ignoring skin changes and warning signs. Let me tell you about another patient. His name was Raymond, 68 years old, and proud to say he'd never needed a urologist, until now. He came to me complaining about a pale patch of skin on the underside of his penis. "It doesn't hurt, doc," he said, "but it's been there for about 3 months. Should I be worried?" I took a closer look. The patch was irregular, slightly raised, and had started to flake. Raymond thought it was dry skin, but I knew better. It turned out to be erythroplasia of Queyrat, a rare form of early-stage penile cancer. Luckily we caught it in time. But what if he had waited another year? See, here's the problem. Most men over 60 assume that every skin change is just aging. A little discoloration? Must be old skin. A flaky patch? Probably dry. A red bump? I guess that's normal. But it's not. The skin of the penis is just like skin anywhere else. It can react to infections, irritation, allergies, or even develop precancerous changes. And because it's a private area, most men don't look closely or talk about it until it's too late. That's why I always tell my patients, if something looks off, and it doesn't go away within 2 weeks, get it checked. That's the rule of thumb. 2 weeks. If it's still there, still red, still flaky, or still weird looking, it's not just dry skin anymore. It needs medical eyes on it. Here are a few things to watch for. A white or red patch that doesn't fade. Sores or ulcers that won't heal. Lumps under the skin. Persistent itching or burning. Unusual discharge or foul odor. Tightening of the foreskin, if uncircumcised. These could be signs of fungal infection, lichen sclerosis, dermatitis, or in rare cases early cancer. All of them are easier to treat when caught early. One man I treated had been applying over-the-counter antifungal cream to what he thought was jock itch. Turned out to be a precancerous lesion that had progressed while he was self-treating. Let me be clear. I'm not trying to scare you. I'm trying to protect you. Because the truth is, penile cancer doesn't hurt. That's why it kills silently. It doesn't scream. It whispers. And if you're not paying attention, you miss the signal. So, what should you do if you notice something unusual? First, don't Google it. The internet will either scare you or give you false reassurance. Instead, take a photo, track it for a week or 2, and book a visit with a board-certified urologist. We're trained to spot the difference between harmless and serious. And don't be embarrassed. Believe me, I've seen everything. And I'd rather see something small today than something life-threatening tomorrow. Now, assuming your skin is healthy and irritation-free, you might wonder, what else could be harming my penis, even if I'm washing properly and checking for problems? That's a great question. And it brings us to a mistake that has nothing to do with soap or skin, but everything to do with what you wear, every single day. Let's talk about that next. Tight underwear and poor hygiene habits. Let me ask you something personal. What kind of underwear are you wearing right now? If you're like most men over 60, you probably haven't changed your underwear style or habits since your 30s. Same tight briefs, same materials, and maybe, just maybe, you've gotten used to wearing them all day, even at night. Sounds harmless, right? Well, not quite. You see, one of the biggest hidden factors that affect penile health, especially after age 60, is what's pressing up against it all day long. Let's talk about tight underwear. Tight-fitting briefs or synthetic materials can raise the temperature in your groin by up to 2 degrees Fahrenheit. And that's enough to reduce blood flow, affect sperm production, lower testosterone, and irritate the delicate skin around your penis and testicles. Remember, circulation is everything. If you're squeezing your manhood all day, every day, you're creating a low-oxygen, high-friction environment. That's a recipe for inflammation, numbness, and in some cases, even erectile problems. One of my patients, Peter, age 66, was struggling with tingling sensations and occasional numbness in his genitals. He thought it was diabetes-related. But after a full workup, we realized the problem wasn't inside his body. It was outside, in the form of compression briefs he wore 16 hours a day. He switched to looser, breathable cotton boxers. And within 3 weeks, his symptoms improved dramatically. Here's the truth most men don't hear. The wrong underwear can choke your manhood, slowly, silently, and daily. But it doesn't stop there. Let's talk about hygiene habits. Many men wear the same underwear for 2 days in a row. Or throw it in with the rest of their laundry, using heavy detergent and fabric softener. Some even skip washing their groin thoroughly at night, especially if they already showered in the morning. And if you sweat a lot during the day, especially in warmer climates or after light exercise, bacteria can build up fast. This creates a moist, warm environment that invites fungal infections and skin irritation. So what should you do? Here's a simple checklist I give to my patients. Switch to 100% cotton underwear. It breathes, it absorbs, and it won't trap heat. Avoid tight fits. Choose boxers or relaxed briefs with gentle elastic. Change daily. No exceptions even if it feels clean. Wash your underwear separately using unscented, gentle detergent. Never use fabric softener or dryer sheets. They leave chemical residues that irritate genital skin. And finally, never sleep in your underwear. Let your groin breathe at night. It's the only time during the day your body can fully reset circulation in that area. I had one older gentleman tell me, "But I've always worn tight briefs. That's just how I was raised." And I told him this. So was I. But your body doesn't care how you were raised. It only cares how you treat it today. He paused for a second. Then he smiled. And he bought his first pair of loose boxers that same week. Sometimes, a small change in daily routine can mean a huge change in long-term health. Now, we've covered external habits, washing, checking the skin, and what you wear. But what about inside? What happens to your penis and sexual function if you stop using it? Is rest really best after 60? Let's explore that next. Not moving the pelvic area / letting it go dormant. I haven't really felt anything down there for years, doc. It's like the lights are on, but no one's home. That's what one of my patients, Mark, 70 years old, said during his checkup. He wasn't in pain. No specific symptoms. But he admitted something quietly that many older men feel but don't say out loud. I don't feel like a man anymore. When I dug deeper, it turned out Mark had become increasingly sedentary over the last decade. He used to hike, stretch, and walk his dog every morning. Now, he sat most of the day, rarely exercised, and hadn't had sex in over a year, not by choice but by a slow, silent withdrawal from physical intimacy. Here's what most men don't realize. The penis doesn't just rely on hormones and blood flow. It depends heavily on the health of your pelvic muscles. Your pelvic floor is a network of muscles beneath your pelvis that supports your bladder, bowels, and sexual function. When you don't use these muscles, they weaken, just like any other muscle. And over time this can lead to loss of sensation, weaker erections, dribbling after urination, difficulty holding urine or gas, a general sense of disconnect from your own body. And here's the scary part. You don't have to be 80 or 90 for this to happen. It can start as early as 60, or even earlier, if you're inactive. But there's good news. Just like you can rebuild your legs or back through exercise, you can revive the strength and function of your pelvic floor. The best place to start? Kegel exercises. These are not just for women. In fact, I teach every man over 60 how to do them. They strengthen the muscles that control urination and blood flow to the penis. Here's how. While sitting or lying down, tighten the muscles you'd use to stop urinating midstream. Hold for 3 to 5 seconds, then release. Do this 10 to 15 times in a row, 2 to 3 times a day. Avoid squeezing your thighs or buttocks. Focus on the internal lift. It's subtle, but powerful. In just a few weeks, many of my patients report better control, stronger orgasms, and even firmer erections. Pair that with light walking, pelvic tilts, or planks, and you've got a routine that restores circulation, coordination, and confidence. One patient said, "I didn't expect it, but after 2 weeks of daily Kegels, I woke up hard again, for the first time in years." That's not magic. That's blood flow. That's movement. That's reconnection. Because here's the truth most men don't want to hear. If you stop using it, you don't just lose it, you forget it's even there. And that disconnection isn't just physical. It becomes emotional. It starts affecting how you see yourself as a man, how you feel in your clothes, how you speak to your partner, how you carry yourself in the mirror. But when you reawaken that area, gently, consistently, you start to reclaim that part of yourself. Now, some men ask me, is it too late for me? I've already lost so much function, should I just accept it? And that's when I ask them a different question. Are you treating the root cause, or are you just reaching for pills to cover the symptoms? That's a question we need to explore more deeply. Because the next mistake many men make, perhaps the most dangerous one, is what they put into their bodies, not knowing the risks. Let's talk about that next. Self-medicating with pills and quick fixes. Let me tell you about Kevin. He was 61, recently divorced and trying to get back out there. He wanted to feel confident again. But things weren't working like they used to. So he did what a lot of men do. He searched online. He found a supplement claiming to be natural Viagra. He ordered a 30-day supply from an overseas website. Took one pill before a date, and ended up in the ER with his heart racing, blood pressure crashing, and a pounding headache that wouldn't stop. The diagnosis? Severe hypotension from an unregulated sexual enhancement pill. One that wasn't FDA approved, wasn't tested, and could have cost him his life. Kevin was lucky. Many men aren't. See, one of the most dangerous habits I see in men over 60 is this. Trying to fix complex problems with quick fixes. Sexual function is not just about arousal. It's not just about blood flow. It's not even just about testosterone. It's about your brain, your heart, your vascular system, your hormones, your nervous system, and your lifestyle, all working in sync. When something goes wrong, the solution isn't a shortcut. It's a map. But too many men are afraid to look deeper. So they grab a pill. Or a powder. Or some manhood juice from a shady Instagram ad. And they don't know what's in it. Or what it's doing to their liver. Or how it's interacting with their heart medications. Or why it's making things worse, not better. I've seen patients lose their ability to naturally get hard because they relied too long on pills instead of solving the root issue. I've also seen men reverse years of dysfunction by making changes to their diet, their exercise, their stress levels, and their connection with their body. One man told me, "Doc, I finally stopped chasing pills and started chasing health." And that's when everything changed. Because here's the real truth. The strongest erection doesn't start with a pill. It starts with how you live your life, every day. You want better erections? Check your blood pressure. Look at your waistline. Measure your sleep. Track your stress. Move your legs. Breathe deeper. Laugh more. Touch with intention. That's the kind of medicine no pharmacy sells. But your body remembers it. So what should you do instead of self-medicating? Here's my advice. Get a proper evaluation. That means checking testosterone, cholesterol, blood sugar, and penile blood flow. Talk to a real doctor. Not a salesman. Not an influencer. A board-certified urologist who treats men like you every day. Be honest. About your fears, your habits, your history. We're not here to judge. We're here to help. Be patient. Healing takes time. But it lasts longer than any pill. And if you're already taking medications, make sure they're prescribed, safe, and monitored. Don't mix them with supplements unless your doctor approves. Because your manhood is not something to gamble with. It's your identity, your joy, your confidence. And it deserves better than a mystery capsule from the internet. Now, we've walked through 5 of the most common mistakes I see in men over 60. And the real solutions that can change your life. But what's the bigger lesson here? What do all of these points have in common? Let's wrap it up together, with a message I think every man needs to hear. Let me say this clearly. Your penis is not just an organ. It's a reflection of how you've lived, how you care for yourself, how connected you are to your body, your health, and your confidence as a man. After 60, Many men are told to slow down, to accept that decline is inevitable, to just be grateful for what still works. But I don't believe that. I've seen men in their 60s, 70s, even 80s reclaim their vitality, not through magic, not through pills, but through awareness, care, and action. So let's go over what we've learned. First, stop overwashing or using harsh soaps. Be gentle. Second, pay attention to skin changes. Don't wait, act early. Third, wear the right underwear and clean it properly. Fourth, move your pelvic floor. Reconnect with that part of you. Fifth, stop chasing pills. Start chasing real health. None of this is extreme. None of this requires surgery or secrets. Just small, intentional choices that protect the most personal part of who you are. And if you take nothing else from this video, remember this. Taking care of your penis after 60 isn't about ego. It's about dignity. It's about loving yourself enough to preserve what makes you feel alive. To respect your body, not for what it used to do but for what it still can do. If this message spoke to you, if you've been dealing with any of these issues in silence, if you want to feel more in control of your health again, please leave your questions or stories below. Like or share this video if you found it truly helpful. Someone else out there might need to hear it just as much as you did. Take care of yourself. You deserve it.